Chapter 24 Infections. Exercise 24.1. Match the two parts of the sentences. Look at A, B, and C opposite to help you. Number 1. Um, 1988 saw the UK launch of live attenuated letter J, measles, mumps, and rubella MMR vaccine. Number 2. Chickenpox, varicella, is a common infectious letter E disease of childhood. Number 3. Rabies has an incubation letter A period ranging from 4 days to many months. Number 4. The patient remained febrile. No, letter H, with peaks of temperature of 30, 39.5 degrees Celsius. Number 5. He was admitted with a 4-day history of influenza-type symptoms of fever with letter B, rigors, myalgia, and general malaise. Myalgia, rigors, myalgia, and general malaise. Number 6. Quite a proportion of patients who recover from hepatitis B, letter C, become carriers of the virus. Number 8. Measles, rubella is most, letter D, infectious during the collateral stage. Number 9. Lyme disease is caused by transmission, letter G, of bee burden from animal to man by exotic ticks. And number 10. PUO stands from I, letter I. Pyrexia of unknown origin. Pyrexia of unknown origin. Exercise 24.2. Complete the case report on the patient in opposite. Look at A, B, and C opposite to help you. Case 45. On examination, he looked unwell. His pulse rate was 100 minutes. He had a palpable spleen. The combination of fever and rigors in a patient who has recently returned from Africa strongly suggests a diagnosis of malaria. The incubation period is usually 10 to 14 days. In this case, the patient admitted he had not been taking drug prophylaxis regularly. The diagnosis was confirmed by the presence of parasites in his blood film. Exercise 24.3. Complete the sentences. Look at A, B, and C opposite to help you. Number 1. An infection which can be treated successfully with antibiotics is curable. Number 2. Another word for an epidemic is an break. Number 3. Bacteria and viruses are examples of microorganisms. Number 4. Someone whose temperature is normal is afebrile. Number 5. The common infection with Epstein-Barr virus is known as glandular fever. Chapter 25, Mental Illness. Exercise 25.1, complete the table with words from A, C, D, and E opposite. Noun, adjective. Effect, effective. Anxiety, insidious. Behavior, behavioral. Dementia, demented. Disturbance, disturbed. Suicide, suicidal. Exercise 25.2, make word combinations using a word of each box. Two words can be used twice. Look at B, C, and D opposite to. Number 1, behavioral syndrome, eating disorder, major depression, mental retardation, personality disturbance, psychomotor retardation, sleep disturbance, substance abuse. Exercise 25.3, complete the sentences. Look at A, C, D, and E opposite to help you. Number 1, the way a person behaves is his or her behavior. Number 2, a persistent emotional state is a mood. Number 3, a sudden attack of anxiety is a panic attack. Number 4, the form of dementia associated with aging is called senile dementia. Number 5, a disorder which is not associated with pathological changes is dementia. Number 6, an idea which forces a patient to repeat unnecessary actions is a compulsion. Number exercise 25.4, which symptoms of depression was this patient suffering from? Look at C opposite to help you. Case 41. A 66 sorry, a 56 years old woman presented to her GP complaining of increasing tiredness over the past few months. She had lost interest in most things. She was sleeping poorly and tended to wake up early, but denied uh, any suicidal tendencies. She was thirsty and was passing urine more often. She was eating normally and her weight was steady. The patient has tiredness, loss of interest, and insomnia. Chapter 26, the nervous system 1. Exercise 26.1. Complete a table with words from A, B, and C opposite. Adjective, noun. Blind, blindness. Conscious, consciousness. Deaf, deafness. Dizzy, dizziness. Numb, numbness. Lightheaded, lightheadedness. Unsteady, unsteadiest. No, sorry, unsteady, unsteadiness. Exercise 26.2, make word combinations using a word from each box. Look at A, B, and C opposite to help you. Double vision, epileptic fit, coronal symptom, syncopal attack, urinary incontinence, urinary incontinence, visual acuity, Exercise 26.3. A doctor is trying to determine the cause of loss of consciousness in a 52 years old man. Complete the doctor's questions. Look at C opposite and at the table in 26.1 above to help you. Did you lose consciousness suddenly or gradually? Did you get a syncopal of the attack? What were you doing before you passed out? Were you worried or under any stress at the time? Did you feel dizziness or lighting headache before the attack? Did you lose control of your bladder? Did your wife notice any involuntary movements while you were unconscious? Chapter 27. The Nervous System 2. Exercise 27.1. Complete the table with words from A and B opposite. Noun, adjective. Absent. Absent. Diminution. Diminutive. Flaccidity. Flaccid. Spasticity. Spastic. Wastage. Wasted. Exercise 27.1.2. The doctor is giving instructions to a patient during examination of the motor system. Identify what the doctor is assessing in each case. Look at A opposite to help you. Number 1. It like you to relax. I'm just going to move your arm up and down. Muscle buck. Number 2. Can I see your hands? Muscle thumb. Number 3. Now, I'm going to straighten your arm out. Try to stop me. Muscle power. Number 4. Can you touch my finger with yours and then touch your nose? Good. Now, do it again with your eyes closed. Coordination. Exercise 27.3. Complete the sentences. Look at A, B, and C opposite at the table in 27.1 above to help you. Number 1. A flaccid head droops limply to from a right ankle with the wrist. Number 2. Brisk reflexes are reflexes that are stronger than normal. Number 3. Muscle wasting means the muscle is reduced in bulk. Number 4. A tic is a form of involuntary movement. Number 5. A key is often used to test the Babinski response. Babinski response. Number 6. His coordination was poor. He could not perform rapid alternating movements. Number 7. A reflex hammer is used to test reflexes. Number 8. When something is involuntary, it is less than normal. Exercise 27.4. A patient is buffed to A and E in coma when her name is spoken. She opens her eyes, but she does not answer questions or IV obstructions. What is her DCS score? The plantar reflex.